households have toilets. In 1991, it's 9%. 2001 census, 22%. We started major sanitation program in the International Decade of Sanitation, 1980, with the Central Rural Sanitation Program, the CRSP. Realized by the 90s it wasn't going anywhere because it was hardware focused, so we started talking about behavior change. Started TSC in 1999. TSC becomes a big story through 2000, the first decade. And most of us, I think many of us have heard of this, and there are some books written on this sanitation revolution in India in the last, the first decade of the 21st. What is this revolution? This revolution is toilet coverage in official literature goes up from the census figure of 22% in 2001 to 73% by the end of the year. Nirmal Gram Puruskar introduced in 2003 when we recognized the public good dimension of sanitation timing in India, theoretically at least, and realized that it's not about individual households acquiring sanitation, but it's about entire communities if we really want to get secure the positive externalities of sanitation. Because sanitation is the classic public good, and if everybody doesn't adopt, nobody gains. And what do we find? That we have till now awarded 10% of rural populations, rural local bodies in this country already by last year, the year before. Over 10% of rural bodies have been awarded with the Nirmal Gram Puruskar, which means that at least 10% should be really sanitized in India. What's the actual story? And I think most of you are familiar. The 2011 census, based on household surveys of 2010, shows that actual coverage increase of households with toilets in rural India was from 22 to 31%. There's a 42% gap, which the CAG report 63 million sort of fits in with. 42% of the toilets, at least 42%, don't exist. At least 42% is just raw, pure from 22 to 31, 73 minus 31. In actual fact, much more than that are lost. Because in actual fact, you didn't, the 73 million constructed toilets were 73% constructed toilets are far more. The amount of construction which went on in this decade was incredibly more than just this 42% gap. On Nirmal Gram Puruskar, very few surveys. We don't really believe in much evaluation in this country. We just believe in putting in the inputs. We know, as Kamalda says, we know what has to be done. So we'll go ahead and do it. We don't need to evaluate and record what actually happens. In actual practice, if you look at, there are very few surveys of Nirmal Gram Puruskar, actually what happens, but there are a few surveys. There's 2008 UNICEF survey, there's a CNS study of 2010, one or two other small surveys. What do we find? 2% of Nirmal Gram Puruskar villages are actually open defecation. And in large numbers of them, open defecation in excess of 40%. It is in this context that I just want to tell you very briefly a small story from my little state of Himachal Pradesh. In 2003, Ajay was involved in some of the initial rapid assessments which we did. We found that in rapid assessment, the census figure for Himachal Pradesh was rural household coverage with toilets 31%. Rapid assessment showed it was about 29%. So pretty much similar. In 2006, we were pretty much virtually at these levels. And suddenly, the census shows in 2010 household surveys that we are at 68%. It's the fastest, most dramatic growth in the whole of India in coverage of rural sanitation, rural households in the entire country. The census shows state by state that no state came anywhere near the kind of success which Himachal Pradesh demonstrated. A survey in 2010 of Nirmal Gram Puraskar with Gram Panchayats in Himachal, which by then were about 20% of the Gram Panchayats of the whole entire state, with just around 20% by then, showed that over 90% were open defecation free, as opposed to 2% for the country. Here was a state which had Nirmal Gram Puraskar winners independently assessed about 90%, or was it 86% or something, were open defecation free, and the balance at less than 10%. It's interesting. If you went and spoke with in Himachal today and asked people what accounts for this transformation or change, you'll get many kinds of voices. Some voices will say, oh, it's all dying out. What is there? There's still migrants sitting in the open. People are stuck very concentrated. But this dramatic change is there for all to see, for anybody who's actually seen. Because for people, it still irks them that there are few people still going out in the open. But for the majority, for someone who understands, when you ask them what happened, how did you do this, and where did the money come from, everybody will say, we understood what was happening to us. We understood that we were eating shit, that we were ingesting shit, that it was causing a problem, and we decided to do something about it in village after village. So what really caused this revolution? There was, as everybody will say, there was commitment. Yes, there was commitment. There were champions. But at the heart of it was the fact that in 2005 January, this state, through a cabinet decision, said, we will stop talking about toilets. Sanitation is not about toilets. Sanitation is about the money. And we will stop having targets of toilet construction. We will stop giving subsidies for individual household toilet construction. In this state, there will be no more subsidies for individual household toilet. Whatever money is there which comes through programs, we'll give as a reward later for open defecation free communities, which sounds a bit like NGP, no? But in actual practice, over 3-4 years, virtually no money was disbursed at all in Himachal Pradesh. No money. No money came. Government of India did not give money because they said you are not reporting, your toilets are already built. This money was for building toilets, but the toilets already exist. There is no need for any money. And when you go to the communities and ask them, they say, what subsidy? This is our problem. We sorted it out. If we didn't get any money, we didn't ask for it. So the core issue is that here was a state which took it up as a challenge and said, we want to get collective behavior change. In village after village, devised a strategy, went forward, and I can talk about the strategy when there are questions. But I wanted to keep this story brief before questions come. And I just wanted to say, it was a case of what Kamalda at the end said, creating enabling environment, and then things work. And by the way, in Himachal, if you go and ask anyone, no one's heard of community-led total sanitation. CLTS as a term is not being used in Himachal. Why? Because CLTS was a term which was completely unacceptable in Government of India in those days. If you use this term, it was considered to be anti-Government of India programs. It was considered to be something which, so no state, nobody wanted to use this term. And it has not been used in Himachal. And yet it is a classic case of collective behavior change, which is what CLTS really propagates. So, having achieved this in this brief time span, what is it that today CLTS has far more acceptability, it's used in Government of India documents, it's used in state strategies, and what you have is, you picked up the triggering aspect, you picked up the tool that CLTS uses, one tool, in fact, triggering, it could be any number of tools, any way of triggering could result in collective behavior change. You've just picked up this one business of drawing maps of doing fecal counts, of doing transact walks, and said, walks of shame, etc., and said, this is CLTS, and oh, this has great potential for demand creation. Let's go out and do this, and we've got, this is behavior change strategy, this is communication, and we create ODF communities. Why doesn't it actually happen when you don't have an individual environment? And this is what I thought we could spend a little time talking about, because this is what really involves us. This is what really concerns us as Indians, is that we have this policy environment which says, I want to subsidize toilets. I want to link it to even Manrega for labor, which will construct toilets and superstructures, etc. And today, everybody thinks, oh, I'll go ignite communities, I'll get them to think about behavior change, I'll get a demand for toilets, and then I'll deliver it beautifully through this route of individual toilets. Why doesn't this work? I think the simplest answer has already come when Kamala spoke about NG. That here was a program that said, a reward for everybody creating a sanitized village, here's a pot of money, and why don't you go out and do it? And our whole system said, I'll go and count the toilets and I'll give you the reward. So I'll show the toilets, I'll show the cleanliness, and I'll get the reward. So it's the same thing, as long as you are promising a household, a pot at the end, whether in terms of individual household money or a Nirmal Gram Puruskar. If you are saying, I'll create the demand and then I'll give you this pot, the pot is what is driving it. It's not about behavior change fund. And then everybody is waiting. Today I find in villages in Meghalaya, where we actually had a practice of CLTS, where we actually had communities being energized, being empowered, and they were thinking through the process. Now they're waiting. They're sitting back and waiting. Manrega money will come. The balance money will come from NBA, Nirmal Bharat Abhiyan, and then we'll really build our toilets. We've been ignited, we've been triggered, now we move to fixed point open defecation, we have a little pit and we shit in that, and the real toilet we'll build whenever the money comes. So when Manrega tranche is released after 1 year, when NBA money will flow, then we'll think about making a toilet. And you could wait and go to endlessly. And in actual practice, it means that you will relax. That your whole triggering will have been meaningless, and next time around it's going to be twice as more. To really talk to people. Today, as Kamalda said, in Nainital district of Uttarakhand, if you go, the key research center of ATI Nainital has trained people from every district in India. In villages there, they've gone and done triggering exercises, got people to come, see that. So today, when you go to those villages, people have started drawing the map, putting in those slips of paper, even as they see the cars coming. Oh, another round of exercise, we'll do the triggering today. They're all merrily defecating in the open. It's become a very nice round of things to do, of showing that this is what CLTS is. So CLTS, without that enabling environment, is a hoax. It's not CLTS. It's actually a bad name for CLTS, because CLTS is about sustainable behavior change. It's not about just triggering and telling some people or making people tell themselves each other stories. The sustainability can only come when people really feel it is their problem. It's not somebody else's problem. And what subsidy and why CLTS says that an enabling environment requires the absence of subsidy is finally because subsidy from above, subsidy from outside, is telling people that this is not your problem. It's somebody else's problem who wants to give you money. Nobody says the poor don't need money. The poor need money. Poverty is an issue. But who is to give that money? Who is to help the poor? It is the community itself. It's the people from within the community, the better off sections within the community, the more thinking people within the community who have to organize, whether it's through self-help groups, whether it's through small loans, whether it is some richer person in the village itself saying, no, I'm going to construct toilets for this a really deprived household in my village, because I understand and I don't want to eat this poor person's shit. It's not about someone standing from outside the environment and coming and saying, I'm going to make your toilet. Because the moment you're doing that, you're breaking the whole idea that this is an empowered community understanding its own problem and wanting to resolve its own problem and understanding that it is their problem. It is becoming somebody else's problem. The moment you're making it somebody else's problem, you're finishing the idea that there is going to be sustainable behavior change. And that is the crux of the issue of being opposed to subsidy, is that it breaks up the community. It also, if you have subsidy for some poor people, it's also dividing the community. It's also saying some people's shit is okay to be confined, and some people's shit need not be confined. It is, thirdly, it is focusing on toilets. It's not focusing on behavior change. The moment you have subsidy aligned to toilets, you are talking about toilets. You're not talking about behavior change. And the entire government machinery, the entire machinery which is involved with sanitation is shifted. Its entire focus is about constructing toilets, counting them, showing expense sheets with so many toilets constructed, so much subsidy disbursed. It is their annual report card. It is about number of toilets, number of amount of expenditure incurred. That is what that person is being evaluated for in our system. The block person, the engineer, whoever is in charge at the local level, his disbursement profile is about subsidy. He's being asked how much did you spend and how much subsidy did you disburse, how many toilets were constructed. So your whole focus is shifting from behavior change to a mere input, a mere process, which is a toilet. So which is why CLTS ultimately says that I have to get an enabling environment which shifts this focus. And that's what Himachal did. So no longer was that video and that worker involved in the sanitation program being asked how many toilets made and how much subsidy disbursed. That person was being asked how many facilitators created, how many gram panchayats did you reach with the message, how many gram panchayats formed community committees, how many of these committees developed action plans, how much of that action plan has been achieved. These were the questions, these were the monetary performer which went into place for the government machinery. It was not about how many toilets, how much subsidy disbursed. It was irrelevant. So the whole government machinery's incentive structure, what it was counting and what it was delivering, changed completely and dramatically from what it does now, when your focus was not subsidy and toilet. And that is one reason, as I said, that the whole program, it becomes completely about not behavior change when you focus on subsidy. So opposing subsidy, seeking an enabling environment, twofold reasons. One, the machinery itself gets focused on the wrong targets, and two, the community itself gets broken up. The community itself is focusing on the wrong thing and thinks it's not their problem, it's somebody else's problem. So I hope I've managed to convey the reasons why we say that CLTS doesn't work, doesn't give sustainable results without an enabling environment. So when we go across, Ajay will tell you that they have now covered about 100 districts in this country, and another organization, KRC, between them, probably covered the whole country by giving a message about CLTS. And directly district-wise input of 5-day training modules, including triggering, creating leaders, etc., probably 150 districts at least in this country, if not more. And yet you'll find that if you do a census-wise analysis of districts, the census is still not made available, sanitation figures by district yet, household-wise. They will be making it available state by state soon, but right now we only have statewide figures. But even statewise, it's very clear that if you've held trainings, if you've done this work and you did not have an enabling environment, there's a dramatic difference in the results. The results, there are places where very committed district managers, collectors, I think deputy commissioners, you call them in Karnataka, like in Himachal, where say a committed deputy commissioner or collector or DM has shown great interest, or the development person has shown great interest and has lasted for some time, and you might have got some very good results, but they don't sustain. If the message from the state is not right, the results do not sustain. They will go back, fall back, there will be in water they call slip back. There will be slip back of the habitations. They will slip back into the practice of implementation. So the core message I wanted to just give is that why no subsidy, and how do we get this? We have to, as Kamala says, there are two levels of this. One, the states, if they want to show initiative, we have to convince the state in which we work that there is no option. You will have to put subsidy on the back burner. You will have to change your thinking on this if you want to achieve results. And if we can get them to do this, even if we can get them to be flexible on this, give the freedom to local level managers that you don't follow the subsidy regime, it is possible that you will get results. If you don't, you will not get sustainable results. Try what you will. You can have as many behavior strategies as you want to develop. You can keep using CLTS, you can keep having feedback, knowledge links, X, Y, Z, triggering in district after district, talking about CLTS, saying we'll create demand. You will fall back to the same story which we have fallen back in 150 districts, 100 districts in this country. You will keep relapsing to the same story, and as Ajay will say, you can keep looking at 2080 for sanitary size states or 2100. You're not going to get there. It's going to be a dismal picture. Don't let yourself be deluded that there is a compromise, there is an ability to harmonize. There is none. You will not get anywhere, because there is a fundamental fallacy in thinking that you can at the same time empower the community, you can make the community ask the questions, resolve to take action, and at the same time you can tell the community, here's a dole. Because the community and people understand very much that if you are saying here's a dole, it's not my problem. It must be somebody else's problem. That's why I'm getting it dole. Apart from anything else, I just wanted to address two questions and then we can go into question mode. I'm going to keep this very brief, and I really would like to engage in a larger debate. There were two issues which I just wanted to speak about. One, why do we keep talking about subsidy? Why does government of India and Jairam Ramesh keep saying the poor need the money? In my view, the first is simply, as Kamalda will say, we are a very rich country. We are very rich in a tradition of patronage. In a politics of 60 years which says, I have to help from above and I have to be seen as the patron who gives. The central government as patron, the state government as patron, I have to do patronage, the poor depend on me for patronage. That's the way my whole system works, and that's why even a toilet must be part of the patronage structure. That's one, and then we have great research to back this up. Lovely, wonderful research which will say, this is totally true, the poor need money for toilets. So you have, now if you go to a Government of India presentation, everybody will show you the 2010 CMS study. Right, Ajay? You've seen that 2000, has everybody seen the 2010 CMS study? Huge study across the country, massive number of households covered. What does it say? Why do people not have toilets or do not use toilets? So it will say, here, see the graphs, lovely graphs. I'm not carrying them with me, but they're lovely graphs which will show so many households said we are too poor, we can't afford toilets. So many said technology given to us was very bad, and so many said there's no water. You know the things. These are the reasons the Government of India says, see, and Jairam Ramesh tells me, see, the research shows that people don't have money. If they had money, they would build toilets and they would use it. What's wrong with this? Any thoughts on it? What's wrong with this? If this is true, then we are talking rubbish. I am talking rubbish, Kamala is talking rubbish. What's wrong with this analysis? What is fundamentally wrong with this analysis is, what is the question it is asking? It's asking them a question. It's saying, why don't you use toilets and why don't you have a toilet? But it's not about toilets at all. If I were instead to ask them a question that Ajay has often asked in his surveys, I just ask the community, what do you need? What are your priorities in life? What do you really miss? What do they trot out? What will they say? Any thoughts? What are people likely to say if you go to a village and ask them, what is it that you need?
Never a toilet.
Never a toilet. Thank you. Never a toilet. It doesn't figure anywhere in any priority. So it is not about asking them about why don't you use a toilet and why don't you have a toilet. It's first about making sure that sanitation is a felt need. It's something which really is about. Then that is the question to pose, is to understand. And then from that graduate to that if sanitation is a felt need and it is understood as a public good, then how does the community react to that? The community reacts by saying, I'm going to do something about it myself. I don't need anybody. And the moment somebody is saying from outside that I want to help you, and then it's your problem, buddy. Go ahead. I'm doing fine the way I was for decades. There was a question about sanitation ladder, and this is a question which will keep cropping up in our minds. Technology is very important. As Kamala says, and pointed out in his figures, technology, simple, safe confinement of excreta is such a simple situation in almost 60, 70, 80, 90% of the country or the world. Safe confinement of excreta is simple. It is not complex. It's a simple pit latrine, which you cover. If you do not allow flies to interact with the shit which is going into the pit, you're safe. If you ensure that the pit is not deep, it's not hitting water table, it's not hitting aquifers, it's confining excreta safely, you're making sure it's not interacting with the external environment through flies and all, you've got safe confinement. The concept of sanitation ladder should arise in our mind only if you're using a method which is not safe. If you are using a safe method, it is simple, so what? It doesn't cost money, so what? Is it confining excreta safely? That's my key concern from a health perspective. It's not about aesthetics, it's about health. And if as a community I'm achieving that, it's good enough. I don't need to talk about water, to pour flush latrines and fancy superstructures. So, I would like to leave you with this thought that when we look at sanitation, when we criticize and we say, oh, CLTS is only leading to poor technology. If it is leading to a technology which is not confining excreta safely, then yes, it is something I must criticize. If it is confining